Hello everyone and welcome back. Welcome to our first episode of our Infection Prevention and Control podcast. So we have decided to switch over to a podcast because Jen and I don't think we're cut out for the camera, to be honest. So we have switched to a podcast, and then it makes it a bit easier if you wanted to switch on in the background and just have a little listen. So I am Fran, I'm one of the Infection Prevention and Control nurses.
Hi everyone, welcome to our very first podcast. I'm Jen Farmer. I am one of the Senior Infection Prevention and Control nurses.
And hello, my name's Amy Cartwright. I'm a clinical educator for Gamma Healthcare, or Clinell, as everybody seems to know us better for.
So we are going to be talking about, I know in our last vlog we said that we were going to be talking about water safety, but we have decided to change it up to a spring cleaning episode because obviously it's getting a little bit warmer, a little bit brighter in the evenings, which is nice. So we thought it would be an appropriate subject to go on to. So we've got a few things that we are going to discuss today. So Jen, what are we going on to today?
Thanks, Fran. So, as Fran mentioned, spring clean episode. That's why we've asked the lovely Amy to join us today, just for her to go through some of the products that we use from Clinell. And it's just we know that everybody knows this, but it's just helpful as a bit of a refresher sometimes because it can be easy for it all to sort of blur into one a little bit. So Amy's just going to kind of go through some of the products that we use and what we might use them for and in what instance we would be using the different products.
Yeah, so there are four main products you really use from Clinell in the trust. So the first one, and the one you'll all be most familiar with, are the green packet universal wipes. So these are a 2-in-1 wipe. They've got a detergent in them to help you clean sort of any organic matter, and then they've got multiple biocides in which help from a disinfectant point of view. So the nice 2-in-1 process. Before that, years ago, you would have to use a detergent, wait for it to dry, use a disinfectant, wait for it to dry, and then eventually you'd kind of done the clean that you should do. And that was the whole reason that the founders of the company put this wipe together. And it was one of the first on the market to be a 2-in-1 wipe. So hopefully that's kind of made things a little bit easier when it comes to cleaning. So a few things to think about with the wipes, though. So the way that you store them, ideally you're going to use those nice green dispensers that you've got in your clinical areas. The idea for that is that it stores the wipe the right way up, and therefore every wipe gets some fluid on them in that packet. Otherwise, if they're flat on their back, it means that all the fluid sinks to the bottom and the top wipes become dry. If they become dry, you're going to use more, you're going to have to waste some, they're not going to be as effective, and we don't want that. So hopefully you're going to use them stood upright in a dispenser.
And if you ever need any more of those dispensers, you can just give the infection control team a ring, and we can bring you some up. We've just got some more on order now, and if they're ever looking like cracked or getting a bit old and tired, just give us a ring and we can bring you some up.
Yeah, equally if there's new departments, if you've had a refurb and the old ones have been taken down and you need a whole suite of new ones, don't hesitate to reach out. We send in as many as you need. So just reach out to Infection Control and they'll sort them out for you. So your greens, they're for use on all of your non-invasive medical equipment, desks, phones, chairs, anything like that in your patient areas. They are a really good all-rounder product. They kill things like MRSA, they kill norovirus, they kill CRE, VRE, HIV, hepatitis, coronavirus. Really, really good all-rounder. I know. The list goes on. I have to sort of try and remind myself every time.
Yeah, I bet you do.
Yeah. The only thing they don't really kill, though, is spores. So they don't kill things like C. diff, which segues quite nicely onto the next product that I want to talk about, which are your so these ones are in the red packet, and these are the peracetic acid wipes. So you might have known them as sporicidal wipes. We've recently changed the name. It's exactly the same product, but we've wanted to make it a bit more obvious what the main component is of the wipe, and to think that they're not just for cleaning C. diff. I think everybody thought about, we just use these for C. diff, but actually it's just that higher level clean. That's what we kind of want from them. They're a lot stronger in their formulation. You need to be very, very mindful of your PPE when you're using these. They are dry in the packet. That is how they're meant to be. And we want you to wet them to activate them. So run them under the tap. Doesn't matter what temperature water, but if you use cool water, it means they don't smell as much. And most people prefer to use the cool water. It is it is quite kind to the respiratory system compared to the likes of chlorine. So it's not a respiratory irritant. So that smell that you get off shouldn't be causing you to cough and splutter and things like that, which you sometimes get with chlorine. So that's a bonus.
Ask a question, Amy? Is there like an activation time on the wipes, or is it as soon as they're wet, like that paracetic acid becomes active?
So that's a really good question, and it's one that we get quite a bit. So 15 to 30 seconds is what I would recommend to run it under the tap. And the reason for that is if you ever get one out of the packet, try and hold it up to the light and you'll see it looks really speckledy. Basically, you've almost got two wipes that have been fused together, and in between those wipes, you've got a layer of this paracetic acid powder. And in its powder form, it's quite inert, it's quite inactive. It only comes into its prime when it's wet. So we need you to kind of dissolve that powder. So that's why we don't say use it straight away. So run it under the tap, 15 to 30 seconds. And as you are doing, sort of keep scrunching it up into a ball. And that just helps it dissolve and get it ready to use. So yeah, once you've hit that kind of time period, squeeze it out so it's at the right wetness for you to use, and then just clean as you would normally, following your usual sort of principles of cleaning. So with the reds, we were just talking, you're going to use that for cleaning inside rooms for patients if they've got suspected or confirmed C. diff or infective diarrhoea, anything like that. Any kind of commode that's been used, you're going to use these to clean with, and then your general cleaning in your sluice. It just kind of makes sense from a good practice point of view to do that as well.
Yeah. Can you use like one wipe per commode, or would you recommend changing wipes? Obviously, we'd be following the principles of cleaning from clean to dirty and doing that kind of sensible principle.
Yeah.
But is one wipe enough for, say, cleaning a commode, or would you say more than one?
I think more than one, if I'm honest. We always recommend to change your wipe when you're cleaning as it dries out or it becomes dirty or soiled. But with a commode, because you've got your component parts that you can take off, I would probably use, if it's a relatively clean looking commode, I would use one for your component parts and then at least one or two for the rest of the frame. But obviously if it's soiled, yes, you need to get that soiling off. And once that's off, discard it, use a new wipe. We appreciate that the different sort of states of commodes you're going to have to clean.
Of course.
So so use a little bit of discretion with that, but I would say at least 2 or 3, depending on how dirty the commode is.
Okay,
absolutely.
that's great. Thank you.
Anything else on the reds, ladies?
One other thing I was just going to say. In terms of like the way that you should clean, like with the wipes. Obviously, we've been taught to use the S shape. So is that the best way to?
Absolutely, yeah. S-shape pattern, and the idea of your S-shape is it's a nice continuous motion and you're not going backwards and forwards over an area you've already cleaned. And that's something I learned very much coming into this role. My background is an infection control nurse, and so the fact that it had never triggered to me before, But if you're going backwards and forwards over the same area, the chances are you're going to pick things up, but you're going to put things back down again as well. So you can't have that guaranteed that you're going to remove everything you need to remove. So the idea of the S-shape, absolutely, it's the best sort of system motion to use. We always recommend starting at the top piece of equipment and work your way down to the bottom as well. It's a logical way to clean, but equally, if you've cleaned anything on the bottom and then you start cleaning on the top, you don't know if anything's going to fall off back onto the equipment.
Yeah.
Obviously, we can't see bugs. It would be so much easier if we could.
Yeah.
So you've kind of got that reassurance, and it's just a logical way to clean as well. So you don't potentially recontaminate something you've already done. That's another sort of important one. And obviously, clean to dirty as well. Always wiping from clean to dirty is something we'd recommend for both the greens and the reds. You'd use them in exactly the same way, but obviously just for different pieces of equipment.
Cool. What other products are we using of yours?
So in regards to sort of surface, we're talking the other product is the spill wipes or a spill kit. I really like this product because it should make lives so much easier. And I can remember having been an ex-urology nurse kicking over a urine bottle that had been left by somebody's bedside.
In there.
Absolutely. And what did you used to go for? Probably the nearest bit of linen, what we all refer to as an Inco sheet or something like that. And it's really not the best way to be cleaning up body fluid spills. So with the spill wipe kits, so they're in like an orange sort of packet. In there you've got a super absorbent pad and you've got 2 universal wipes individually wrapped. Now those universal wipes are a lot thicker and bigger than the normal ones that you get in the normal regular packets. And then the outer packaging, that's a key component to this kit as well. The outer packaging is like a disposal bag for you at point of use. And again, I think that's something that's so handy. So if you have any type of body fluid spill, so whether it be urine, blood, vomit or feces, you can use this product on it. I like it again because of urine. Usually conventional spill kits, it's chlorine based and you can't use those on urine because of the ammonia that they then give off. Whereas these you can do. It's peracetic acid based again, so similar to your red wipes. So you've got your big absorbent pad. It's really obvious which side which goes. It's labelled nice and clearly. So drop it down onto your spillage. Obviously urine's going to soak up quicker than blood because it's not as thick. So give it maybe a minute or so to kind of soak up. You might need to press down on it to give it a helping hand. It's a see-through back, so you can see what it's absorbing. Obviously, with things like feces and vomit, it needs to be quite liquid for the spill kit to work. But if there are a few lumps and things like that, they're obviously not going to get soaked up and absorbed. But that's where the universal kind of wipes in there come in to help. So your first universal wipe, you're essentially going to use that to really sort of mop up any residual that's left on the floor. That's where it's quite useful with your vomit and feces. And then the second universal wipe is to give the area an actual clean and disinfect. And as you're using all of these, as you're using the pad and the universal wipes, you can then use that outer packet as a disposal bag to pop them into straight away while you're still sort of doing your job you need to do. If you find that the 2 universal wipes aren't enough, just grab other universal wipes out of the normal packet. Like I say, the formula is exactly the same. It's just the size and the thickness of the wipe that changes. And then, just dispose of it all in the outer packet, and then it can go into your clinical waste once you've finished mopping everything up. So a really sort of handy packet, handy kit to have. Most sort of areas usually sort of stock 2 of them at a time. You don't need to have a whole great big box full of them. Yeah. And again, we do a dispenser for that as well. So if it's something that you're struggling to store or you want it in an easier place to reach, we have a dispenser for those. Again, if you just speak to the infection control team, we can get you some of those.
And all the dispensers are colour-coded, aren't they?
Yes.
So they correspond to the product that goes in them.
Yeah, absolutely. Again, to make it easier for you guys. So usually you only see the red ones, the sporocidal or peracetic acid ones in sluice areas, greens everywhere, and spill wipes are so usually somewhere near a sluice. Again, it's a convenient place, somewhere convenient for people to access them. So they're the 3 kind of surface-based products. And then the other product that you have in the trust of ours, which is more of a skin product, are our antimicrobial hand wipes. So they're most commonly seen in as an individually wrapped wipe, quite often on meal trays and things like that. But we now do a larger pack, a pack of 30, which is the idea of that is it stays with the patient throughout the whole of their journey, and they can access it for hand hygiene wherever they see possible. And I've really noticed a lot of trusts are focusing a lot more on patient hand hygiene. I think we all know how important healthcare worker hand hygiene is, but I think sometimes we forget a little bit about patients, especially those patients that can't get up and about and get to a sink and things like that. So both the individual and the 30-pack are really, really handy. So, it's a nice wet wipe. It's got some aloe vera in there as well to sort of help protect the skin. It's proven to kill 99.99% of bacteria.
nice stats there, Amy.
And I think the biggest thing that people need to encourage patients with them is to clean their hands before they eat, not afterwards.
Yeah,
it's
definitely.
not a freshen up wipe.
Yeah,
it's
not your KFC
Absolutely,
wipe.
and I say that during my training.
Yeah.
No, they are to use before you eat. Some trusts give 2 out, and they give them 1 before and 1 after, because sometimes having that 2 actually makes somebody think, oh, why have I got 2? Oh, maybe it's 1 before and 1 after.
Yeah.
So sometimes that helps with that prompt. The other thing, if you've got patients in particular that aren't using them, that you really think they really should be using them, is give the packet to them open. Everyone's more likely to use it opposed to have their little stash of
you see a little stash on their bedside table.
Yeah, there's like 5 or 6 sat there. They probably take them home, which is lovely. But we want them to be cleaning their hands before they eat.
Yeah. And they're really handy for use, like after, obviously, ideally people would be able to wash their hands with soap and water in the sink, but sometimes they can't. So with any of our patients struggling with using the toilet independently, they can use them after going to the toilet as well, can't they?
Yeah. I mean, nothing's going to replace hand washing with soap and water. That's always going to be the best, but we need to think about an alternative for those patients that can't. And with the best will in the world, those patients that you pop onto a commode, you might provide all of their care for them, but while they're sat on that commode and they're on their own, you don't know what they're doing.
Yeah, or where their hands
are going. So even if you've provided all of their care for them, I think it's still important you use that opportunity to to freshen up their hands.
Yeah,
Absolutely.
I think it helps give them back a bit of a sense of independence as well, doesn't
Certainly
it?
does, yeah.
Just being able to perform those sort of more fundamental tasks for themselves. I've seen we've got these really nice long blue dispensers for the individually wrapped ones, which we put up in some wards, which they just look really nice, and it's a nice visible thing for for everyone, but especially for patients and for relatives to just see how we want to encourage, but how we want to be able to facilitate patients and relatives, I guess, but predominantly patients, performing that hand hygiene.
And this sort of time of the year, especially with norovirus and things like that, obviously we know alcohol hand gel isn't effective. So again, it's another alternative to alcohol hand gel as well, that where that's not appropriate, the patients have still got something if they can't get to a sink.
And we know community numbers are on the rise, people, for norovirus. So watch out.
Yeah.
Into our last little vlog, we've recently had the news, so watch out.
Yeah.
Wash your hands, people.
Not the diet we all want, is it?
Exactly. I think also following on from Jen's comment about independence, obviously a lot of patients, when you're feeling ill and you are ill and you're just not feeling your best, you want to feel clean and just hygienic and
it always helps, doesn't it?
Yeah, exactly. And it just feels nice. Like no one wants to have like horrible sort of dirty, sticky hands really after they've eaten and before they've eaten especially.
Yeah. And it can kind of help you feel hot and sweaty and groggy, like you say, that freshen up just might help cool them down a little bit,
exactly.
things like that.
And as it starts to get warmer as well, like sometimes it can be very warm in the tower block and on the ward, so it's always nice to have a little freshen up.
Absolutely. Well, thank you, Amy.
You're welcome.
For going through those products. Another couple of things we just wanted to mention on today's episode was decluttering your area. Now, Fran, what do we think of plastic wash bowls?
So obviously, well, not obviously, but Jen and I are very, very big fans of decluttering, we'll say. Any chance we get, then that's great. So we, at the moment, obviously it's everywhere has plastic wash bowls, and we really don't like them. We really, really do not like them.
They are perfect little reservoirs.
Exactly.
For harbouring germs, bacteria, viruses, spores. They're just nasty people.
I'm sure sometimes you've gone into the sluice, you've seen a plastic wash bowl, and there's a little bit of a residue around the edges, along the bottom. So as Jen said, they really, really do take up all of those bacteria and whatever, and they're just if you're able to get rid of them, we would encourage that you do so as soon as possible.
And we will happily facilitate that with you as well.
Yes, we will definitely
if you
get
need us
involved
to
in
take
that.
them away, we will come and take them away.
So as a obviously as your alternative, we would prefer if everybody would be able to use those maceratable wash bowls. I know that sometimes they can get a bit heavy and feel like they're going to collapse, but it'll be they don't really do it. I mean, I don't remember having
haven't heard of any issues with that.
Yeah, and I know the boxes take up a lot of room that they're in, but we really would encourage everybody to switch over to those because it's just they're a lot nicer as well.
Yeah,
you know
a lot more hygienic
bowl,
and it's one less item to clean as well because you can just put it straight in the sluice master and it can get macerated.
Absolutely.
I was always told with those to put the cold water in first.
I don't know.
We had some queries in the trust I used to work in about them collapsing, that kind of thing. And the manufacturer actually said to us it's to do with the lining on the inside. If you put the cold water in before you put the hot water in, that does help if you start to have issues with that.
Okay, there we go.
That might be a helpful.
Most of ours are mixer taps, but we could. Yeah, that's definitely a handy little tip for any areas that do have those hot and cold taps.
Yeah, and along the lines of obviously decluttering, I think when we go up towards, and obviously we do audits as an infection prevention control team, it's always nice to see when all of the equipment on the ward is kind of stored away as much as possible, because this really allows obviously for our domestic staff to be able to really clean properly, like really clean the very corners of everything.
And be able to even just like access the floors.
Exactly.
Because in storerooms and stuff, there's so often boxes everywhere because storage is at such a premium. We just don't really have enough space. Yeah. So we have to try to utilise the space that we do have as well as possible so that our domestic colleagues can actually access the area to be able to clean it properly.
Yeah, absolutely. And I think it's also quite important to I think it's quite important to keep patient belongings like with the patient, so storing them away where possible. Then all of your surfaces can be wiped, and it's just a really effective way to just make sure everything's getting cleaned properly and it's nice and hygienic and it looks nice for patients and staff and everybody really. So that's something that we would definitely encourage everybody to have a look at in the spring clean period that we are going through. And also prevents patients' belongings from getting lost, because we all know that patients' glasses and dentures and
Hearing aids.
Hearing aids go missing a lot of the time. So that's something we would definitely encourage.
So another thing we just wanted to mention today was about the different cleans that are available from our domestic services. So our sort of standard go-to clean is an amber clean. That's what we're using when almost every patient is discharged, unless they have any particular infections or organisms such as C. diff, CPE, TB. In those instances, we would want a red clean.
It's all on our rag poster, so you can see that all of the different categories, and then at the top, in the top box, there is the different types of organisms that for each type of clean. So as in like your green, amber, and your red clean. So they're all in there. And pretty much every ward has one of those. Well, they should have.
Yeah,
one of those
and
posters.
if you don't, if the sound of this poster doesn't sound at all familiar to you, just give us a shout and we can bring you one up. It's just we're not really doing green cleans as such. There is a red, amber, and green clean, but we're using the disinfectants. The domestic services are using a disinfectant clean as standard now, so we're not using just a detergent. We're using a disinfectant clean as standard. So the green clean is almost not really applicable because we're not doing detergent cleans at the moment. We're needing that higher level at the moment.
And especially, I would say, with the amber and the red cleans, sometimes it can be easily forgettable that they also need to have a curtain change as well. Obviously, we've got our reusable curtains that go off to be washed, so that's always one to remember. Just check that the curtains have been changed when you are asking for those amber and the red cleans from the domestic staff. Jen, what's the process with a red clean, especially after a C. diff patient inside room? Just anyone, really.
So the only real difference between an amber clean and a red clean is that a red clean has HPV afterwards, and HPV is hydrogen peroxide vapor. So it's a special little machine that's this is all operated by our domestic services colleagues. It's an in-house service that's available 24 hours a day. And you put this special little machine in the room and it pumps out, and the room is then taped up so that none of this vapor can escape. And this needs to be done after the sort of physical clean has taken place and the curtains have been brought down and there's no sort of soft furnishings left in the room. You can then put other items of equipment that you might not need for, the hour or so process that it takes for this to happen. This hydrogen peroxide vapor is then pumped around the room and it's just killing. It's killing spores, it's killing basically anything that's in that room, and making sure that we're eradicating any organisms that are lingering in there that haven't been quite eradicated through the physical cleaning process.
Yeah, and I think also along the lines of that, at the moment we are doing a bit more of what we call banana broth testing. I don't know if anybody's heard of it. So basically what we're doing with this, in fact, Jen, I'm not even sure, does it have anything to do with bananas? I don't know. Do you know?
I mean, it goes yellow.
Maybe that's it. So what we're doing with banana broth testing is when we know that there is a patient who has been discharged, say out of a side room, for example, we might get a call from one of our domestic supervisors to say, can we come and do some banana broth testing? So one of us will come up, we'll bring 5 glass vials with this red-looking liquid in. We'll maybe use a little bit of saline from your ward if you'll let us, and we take a swab. Just a little bit. We squeeze some of our saline over the swab. We take 5 swabs from 5 different areas of the room. So, for example, a door handle, a call bell, the mattress, a chair seat,
Maybe the bed rails.
Bed rails, yeah, exactly. So we'll take that, we'll pop them in the liquid, take them back to the lab with us because we're based in the lab, and then leave them in an incubator. Once the actual physical clean of the room is done, we'll hopefully get another call from the ward or from domestics to say that it's done. We'll pop up, take swabs from the exact 5 same places, and then pop them in the incubator for 48 to 72 hours. And then if the physical clean has been effective, the liquid should stay red. If not, it will go yellow, and that shows that we've still got those C. diff spores lingering around before and after the clean. So if this is something that you're interested in getting involved with, just see what we're doing. If you either catch us on the ward when we're doing it or let us know, we can definitely get you involved if you would like to.
Just chatting through the process, it doesn't take very long.
No,
but just if you see us wandering around with little vials,
just
ask us what's
stealing
going
your
on.
saline from your clean utilities. So that was a little bit on banana broth testing. What else in spring cleaning were we gonna have a little chat about today?
So we could just go through, briefly, a little bit of water safety. So it's really high on everyone's agenda at the moment because we know that in some of our higher risk areas from taking the water samples, we have had some areas that have got Pseudomonas and some areas that have got Legionella within the water systems. And this can be a risk to our patients, and ways in which we can reduce that risk is our estates teams fit filters to the taps so that the water that's then coming through is completely safe. Ways in which we can reduce the risk of the water testing positive. One of the biggest things that we can do on the wards is not disposing of any waste fluids down the sink. So this includes your wash water that you've used to wash your patient in. Don't put it down the sink. You can put it down the toilet, you can put it down the sluice hopper or the sluice master. Either is fine, but just not down the sink. The same applies to any antibiotics or any IV fluids. Although that fluid is sterile, it's potentially, if you're thinking you're putting a bag of dextrose down the sink, you're essentially just putting a bag of sugar down the sink, and it's feeding all of those bacteria and germs that are living within the pipes and potentially causing, allowing that bacteria, perfect nutrients to then grow.
Another one that we see.
Go, Fran.
Cups of tea.
Please
do not pour any cups of tea down hand washing sinks. If these can be disposed of in the kitchen, that is the best thing to do. But often we do see a couple of mugs and sinks around, a couple of tea splashes, and if hand washing sinks can be kept for hand washing, hand hygiene only.
Why can't we pour drinks down the sinks? What's the issue? Why does it matter?
So when you pour a drink down the sink, much like with the IV fluid, obviously it being very nutrient rich, if we're pouring it down, it's got different components to it. If you've got milk, sugar, whatever. So in the sink sort of piping, we get a build-up of what is known as biofilm. So biofilm is basically a complex little matrix of lots of different bacteria and bugs and whatever, and it builds up, and then it's very easily added to with whatever else sort of bacteria is going down the sink. So, for example, if you're washing your hands after you've looked after a patient that's got C. diff, that's all going down the sink, and then it can get caught in that biofilm. So cups of tea and drinks and anything else like that is really like with the IV, is feeding those nutrients in that biofilm. So we'd really encourage that we don't pour drinks down sinks.
Just wash your hands, please.
Yeah, and you'll see some of our lovely stickers produced by Jen that will be coming around and being popped up just above sinks.
Soon,
Give you a couple of facts to have a read of while washing your
so
hands.
just some water safety facts and just some prompts of, this sink is for hand hygiene use only, please, guys.
Yeah, absolutely.
So another thing we has been going on with the help of our GMS colleagues has been a little campaign called Sort and Sweep. There's an off-site storage area which is near the train station, I think.
It's not been personal, but yeah.
And you can essentially just have a massive declutter on the ward, and it's a really helpful way of getting rid of any of those old rickety drip stands that never get used because they're half falling apart. And get your area decluttered. Just get it looking tidier. Everyone feels better working in a tidy, safe, clinical space. So just get rid of your stuff, and we can always come and help you go through any items that you're not sure if you might need in the future. Let's just sort and sweep. Let's get rid of those items.
Jen and I are so excited about this. We love a bit of sorting, love a bit of cleaning. So yeah, we are all up for doing that.
What's going to happen as well is that we'll be able to, what will be available at some stage in the future is that we'll be able to run a sort of swap shop. So all of the items that aren't sort of condemned, they will then go to this off-site warehouse, and there can then be some sort of swapping going on. So if one ward has a ton of drip stands and another ward is actually really lacking in them, we can do this sort of swap shop type thing. So that would be quite good as well to just get some helpful things back up onto the clinical areas.
Yeah, absolutely. Well, I think from everything we've spoken about today, we have covered pretty much all bases. We really have talked about a lot today, but we hope that it has been useful, and thank you to Amy for coming and joining us on our podcast today.
Thank you, Amy.
You're welcome.
Very, very useful. So yeah, that is going to be all from us today. So hopefully we'll be coming out with our next podcast in April. For April. So hopefully you'll be seeing that at the beginning of April. So we usually ask for it to be mentioned on the comms, and then it's also going to be, when I arrange it, is going to be in a little area of our infection control pages on the intranet at some point. So as usual, if you need to contact us at all, we are on extension 6122 for Gloucester and 3129 for Cheltenham. Any out of hours advice, you can go via the normal processes for the consultant on-call microbiologist. But yeah, just want to say thank you for listening.
Yeah, thanks for listening, everyone, and thanks again to Amy.
Thank you for having me.
And yeah, we'll see you next time.
See you next time. Bye.
Bye.